Well, first let me start by saying there's no other place in the world that I'd like to get my personal health care from than right here in the U.S. So there's a lot good about our healthcare system in the U.S. What's wrong with our healthcare system is we have a lot of automation and information that we need to make more connected in this healthcare system. It's a amalgamation of a bunch of unaligned constituencies, and I think we're at a great point in the maturing of our healthcare, or development of our healthcare system here in the U.S., where information is now starting to become more accessible and starting to become more transparent and starting to become more shared. The challenges that physicians and providers are facing is, first of all, the adoption of technology and their changed behavior, if you will. So the ability to change the behavior of a physician, given their training and the sophistication of their job, is a very daunting challenge for any of us in this industry. So what we do as a company, and now with the in-modal technology being part of our portfolio, is we can take a provider from a very comfortable dictation and transcription services relationship into a speech-enabled relationship, and now take that speech, context enable it, and start to send some of that clinical information into EHR systems and other types of software systems to make that adoption of technology easier for physicians. The industry's been very successful in adopting what I consider to be first-generation speech, effectively taking audio files and turning it into text. Our technology is context-enabled speech, which means that at the time that we take that audio file, transition into text, we're also context-enabling that speech. It's that context of that speech that we then can use in other relationships with other applications, if you will. So with EHRs, again, with the physician challenges of learning a new system and adopting that into how they manage their patients, again, physicians have been very comfortable in capturing dictation and speech as a way of capturing the information of that encounter. Working with EHR companies, what we're going to do is take dictation, that audio file, speech enable that audio file, we context enable that speech, and add that context, pull elements of structured data out to facilitate the population of that structured data into an EHR. It does a couple of very important things. It helps with the physician adoption, which is great, but also accelerates the capture of clinical information. It's that clinical information that we're really after, so that we can evaluate physician performance, we can evaluate populations of patients, we can make a different decision relative to the most effective cost and the most effective quality treatment for that patient, because now we've got more clinical information captured faster and in a way for which isn't intrusive for a physician to do so.